The training each day of our training started at 9 o'clock and we worked right through till 5 with an hour off for lunchtime. Quite different to today. At 9 o'clock we all had to present ourselves, this was after the first 6 months, in our uniform, which was white coat, sensible shoes with laces and stockings. You were not allowed to go out without stockings. No jewellery, no fingernail polish, and so at 9 o'clock every morning we presented ourselves in front of Miss Orme and her friend, who we called Stim. Her name was Miss Stimson, but she was universally known as Stim, who was the superintendent physiotherapist. And we had to go before Miss Orme and Stim, show our hands to make sure there was no dirt under the fingernails and we had no nail polish on. If you did, you were sent off to find a big bottle labelled acetone and had to remove the nail polish. And then, having got through that, we then had to turn round, bend down to make sure that our coats did not go above the crease of the knee before we went across to the wards. Of course, what we used to do was actually go and clip our coats up with the stapler so that they looked a bit shorter, and then we'd waltz across even in our sensible shoes and tights. And the first hour of the day was the same every day, and this was called cardiorespiratory. And we would go to see all the patients in the hospital. It was a huge hospital with 700 beds who had had surgery. Now, surgery in those days was quite different. Patients were commonly in bed for 10 days following surgery, even for a gallbladder operation, which we would consider to be so minor today. They wouldn't get out of bed for 10 days. So we would see every patient and give them foot and ankle exercises and deep breathing exercises. And all we did, we made no notes in the record. We gave them a tick in our book to say we'd actually seen them. And that was it. The other thing that we did in that morning, if you were on that duty, was actually to do the post-natal classes. And they were done, again, as a big ward class where all the mothers had to lie on their beds and they would have their pelvic floor exercises and a few very sort of simple abdominal exercises. And the other class that we would do was for the orthopaedic patients. And these were often young men who were in bed for months on end with fractured femurs, having had a motorbike accident or something. And they'd be in Thomas's splints, with huge splints with big weights hanging over the end of the bed to give traction. And they were in bed for 3 months at a time till there was some sort of union. And they would have their exercises on the bed in the ward. So they'd have quads exercises, foot and ankle exercises, a few shoulder exercises, a few throwing balls up in the air, throwing bean bags, and we little girls had to stand in front and give them all their instructions, often to much hilarity and to our embarrassment, I have to say. And so that first hour of the day was the same every day, but you rotated through the different wards to do your classes or breathing exercises.